In the fourth section of our lecture, now we will talk about the syndromes of the menstrual cycle. In this, we will talk mainly about the two syndromes of the menstrual cycle. One is the Mittelschmerz syndrome, and then the other one is pelvic congestion syndrome. Mittelschmerz syndrome, it's the ovular pain. Mittelschmerz syndrome is known as the ovular pain, and this syndrome is mainly, and it's the syndrome in which patient has mid-cycle pain. It's also known as mid-cycle pain. So usually at the time of ovulation, patient have lower abdominal pain, and there is some bloody spotted bloody discharge also. So this is the lower abdominal pain with small blood spotting or mucus with blood also, and this is the indication that patient is ovulating, or it's the time for ovulation. Lot of patients who have this Mittelschmerz syndrome, all the patients usually, or all the females usually don't have Mittelschmerz syndrome or mid-cycle pain. Patients who have mid-cycle pain, it's a good indication, because it's the indication that ovulation is happening, or it's the time, especially for the couples who want to conceive and they want to get patient want to get pregnant. This is an indication that ovulation is this is the ovulation time, so they can have they can try for conception during that specific time period. So Mittelschmerz syndrome is the ovular pain. Nausea or vomiting is usually absent and rarely lasts more than 12 hours. So this period of 12 hours in the mid-cycle, usually the indication that ovulation is taking place. So in this diagram you can see it's the time when ova is released, and ova is in the fallopian tube and reaches the uterus. And this is the time, best time for the conception. Slight vaginal bleeding or excessive mucoid vaginal discharge is also present. At the time of ovulation, usually the mucus is thin, and it's thinning of the mucus also help for the ascent of the sperms to the uterus. So all these are the changes that occur during the fertile period or fertile phase of the menstrual cycle. So Mittelschmerz syndrome is the mid-cycle syndrome or mid-cycle pain. Factors associated with ovular pain, usually increased tension. What leads to Mittelschmerz syndrome, or what leads to the pain during the Mittelschmerz syndrome, is increased tension of the Graafian follicle prior to rupture. This is the time when the follicle is about to rupture for the release of the ova. So at this time, the tension in the Graafian follicle is high, that can cause pain. Peritoneal irritation by follicular fluid following ovulation, contraction of the tubes and uterus. All these are very important factors that leads to pain in the Mittelschmerz syndrome. Next, pelvic congestion syndrome. The other syndrome is the pelvic congestion syndrome, and this is due to disturbance in the autonomic nervous system, which may lead to gross vascular congestion with pelvic varicosities. So increased vascularity or increased congestion in the vessels cause increase of the size of the pelvic veins, leading to varicosities. So The ovarian vein dilates due to valve failure or obstruction to flow. This is the ovarian vein that dilates, leading to varicosities. This causes varicose veins around the ovary, causes varicose veins around the ovaries, which can spread to the pelvis, vagina, vulva, and to the legs. So this can lead to pelvic congestion syndrome. Increase in the pressure of the ovarian veins causes dilation of the ovarian veins, and this dilation causes varicosities around the pelvic organs and different structures. Symptoms are backache and pelvic pain, menorrhagia or epimenorrhea, and then pelvic congestion syndrome. You can see there is venography. You can see the varicose and varicosities and dilation of the veins. Diagnosis is by physical examination, pelvic venography, Doppler scan, duplex ultrasound scan. So in the venography, you can see there are varicose and dilated veins present. CT, MRI, or angiography can also be performed. Treatment is medroxyprogesterone acetate is used for this pelvic congestion syndrome. So thank you for watching sqadia.com.